Hey everybody, Jason McKee here. Today we're going to be talking about hip arthroscopy. This isn't going to be your typical presentation though. I've always thought that PowerPoints were a little bit dull and not very exciting to just sit there and listen to somebody talk. I'd rather be doing something a little bit more active and useful with my time. So today we're going to be giving this presentation and we'll also be going on a nature hike. So bear with me, we're going to give this a shot. So what is hip arthroscopy? Do you know what surgical procedure is growing faster than any other surgical procedure in the United States today? Do you know that more athletes, active people, as well as normal individuals are really realizing that what they thought was a pulled muscle is in fact something that's structural that needs surgical intervention? What I've been describing is a medical term called FAI. So studies have shown that as many as 70% of the people in the United States suffer from FAI. Not all of these people require surgery. Most of them are asymptomatic. They don't even know they have it. But it's something that will still need to be addressed at some point. I've been working in the medical field for the last 15 years. For the last 6 years, I've been working with a company up in Vail, Colorado called Smith & Nephew, and we specialize in hip arthroscopy. We manufacture the instrumentation, the video equipment, all the disposables that we need to perform this procedure. I've seen roughly 2,800 hip arthroscopies in the last 6 years, and I've worked with some of the top surgeons in their field. So first off, let's start talking about the anatomy of the hip. The anatomy of the hip can be broken down into two things. You have the soft tissue anatomy, and you have the bony anatomy. First, we're going to go over the bony anatomy of the hip. The bony anatomy consists of two different bones. You have the pelvis, and you have the femur. If you look at this slide, the image on the left is of the pelvis, and the image on the right is of the femur. The pelvis can be split into three different bones. You have the ilium, the ischium, and the pubic bone. The three of those combine to form this cup called the acetabulum, and that's actually what articulates with the femoral head of the femur. The soft tissue anatomy can actually be split into a couple different categories. We have soft tissue structures of the hip known as the labrum. It would be the cartilage. It would be structures such as any tendon or any muscle, the synovial lining around the joint, the capsule itself. These are all soft tissue structures that will be addressed in hip arthroscopy. Here I have a picture of the acetabulum. And inside the acetabulum you can actually see the cartilage. You can see the labrum, which is the ring around the outside of the cartilage. And you can also see a little tiny tear that they have illustrated right here. Now during these procedures, what we're going to be addressing is primarily going to be what's called the labrum, which, if you look at this structure right here, is the white band of tissue that runs across the middle of the screen. And the white structure at the bottom of that picture is going to be the femoral head. And then that pink tissue in the middle is actually the capsule of the joint. And that's going to play a role later on. So, as we continue on our nature hike, lovely Fort Collins, Colorado, let's next talk about the surgical procedure. So, the surgical procedure is unlike any other procedure that you're going to find on the body. Most people are going to be familiar with knee and shoulder, foot and ankle surgery. The hip is a lot different. The hip procedure can be split up into two basic categories. You're going to be addressing the bony structure, which we call the FAI, which stands for femoral acetabular impingement. And we're also going to be addressing the soft tissues, where you can get tears, you can get irritations. We'll talk about that in a minute. First off, let's talk about FAI. Like I said, it stands for femoral acetabular impingement. And there's going to be three different kinds of impingement seen with this. One is going to be called the CAM impingement, C-A-M. And a cam impingement involves just the femoral neck, and basically you get too much bony growth on the femoral neck. The second type of impingement is called a pincer impingement. Now, a pincer impingement is going to be seen on the acetabulum, and that's where you have too much bony growth on the acetabulum. There's actually an overcoverage. The third type of impingement, which is the most common, is going to be a combination of the two types of impingement. They call it a cam, or a combination cam pincer. These actually would directly relate to the soft tissue issues that we see in the hip as well, because usually when you have the combination of a cam impingement and a pincer impingement, you're going to be impinging on the labrum. When you impinge on the labrum, that's going to lead to a labral tear. And a labral tear is what most people end up going into the surgeon to go see. That's what causes most of the pain. So when they do go to the surgeon and they decide to have surgery, there's going to be a couple of ways they can benefit from that. Next, let's talk about the actual surgical procedure. What are they going to be doing when they go in there? So first off, there will be a procedure where the surgeon can address the bony issues of the hip. This is going to be the pincer and the cam. He's going to do this with a method called a surgical resection. So he's going to have an instrument called a burr or a shaver, and he's going to go in there with these little mechanicalized burrs and actually remove the bone. So it's like a little drill bit that spins around, removes the bone off. And then it's really up to the surgeon to determine how much bone they actually have to remove. The more impingement they have, the more bone that has to be removed. They'll do this on both the acetabular side and the femoral side. The other thing they're going to be addressing in the hip is going to be these soft tissue structures. Now, with this, what they're going to do is there'll be a tear inside the femoral joint, and the surgeon is going to go in there and he's going to find this tear, and then he's going to actually take a drill bit. He'll drill into the bone, and once he locates where this labral tear is, which actually looks much like that, you can see a tear. Once they find this labral tear, he'll take a little drill bit. He'll drill into the bone, and then he'll implant a little device called a suture anchor. Now, what a suture anchor is a small device that's actually implanted into the bone that has suture attached to it. So the implant itself remains in the bone, the suture gets wrapped around the labrum, and then when the doctor ties the suture down, it actually reattaches the labrum to the bone. I have an image here of what that looks like as well. So you can see the two stitches right there at the top of that labrum actually reattaching the labrum down to the acetabulum. That right there is kind of the entire procedure in a nutshell. Once they address the bony impingement, they address the soft tissue tears. That's really all that needs to be addressed in the hip. So, in reviewing on what we went over today, I hope you guys kind of got a basic overview of what really is going on in hip arthroscopy. I hope you understand a little bit better the anatomy involved with the hip. I hope you understand the surgical procedure that we undergo when we have hip surgery. And lastly, I hope you are able to understand some of the instrumentation that we use for this procedure. In closing, on our little nature hike here, I'd like to remind everybody that I think it's great that you take care of your bodies, be very healthy. However, remember, next time that you think you may have a simple pulled muscle in your hip, it might be something a little bit more serious, and you may need to go see your surgeon to get that addressed. So take care. I hope you guys learned everything today, and we'll be in touch. Bye-bye.